That's pretty broad from a 5-hour discussion. But what I would say is I think it's kind of the same insight that I've seen in this a lot for me, which is people keep trying to attack the challenges from a disease state specific approach. But the problem is it's a drug used across probably 100 of different indications in patient cohorts. So a lot of what I think these recommendations came up against was the fact that they operate within a larger system that requires change for them to be effectively implemented. So I think that was a really big piece. Really, just like, because that's the same thing as the fact that, in an ideal world, we have pharmacy dispensing and the idea of patient monitoring and a better integration of care is there. It's not the way the system works right now. So I think that was really my big takeaway is, the success of this is also very dependent on the environment to which cannabis operates generally. I think these are phenomenal recommendations in terms of chronic pain. I actually do think if we can have a win in the chronic pain space, it opens up pretty much everything else. It's at least in the studies we've done, the most commonly prescribed, most common condition patients seek out cannabis for. What needs to be done is it's out of control of these recommendations. It comes down to fundamental policy change at the federal level. So, I think it doesn't mean that these types of efforts should stop. I think they're very important. But, I think a lot of the discussion we've had today, I've been having for like 5-6 years, and people I've been having for 10 years before me. And at the end of the day, it comes down for a bit of leadership from the federal government, Health Canada, in terms of making the medical framework more medical, and that'll just make things like this that much easier. So yeah, I think that's what I would say needs to be done.